welcome to the Health and Lifestyle Hour at TV. I'm Dr. Hilary Ahisibwe. I'm an obstetrician and gynecologist, and I work with NeoCare Clinic and Fertility Center in Mbarara. Today we are going to talk about menopause, and since 2 days ago was World Menopause Day, that is on 18th of October. For the last about now 20 years, there has been a celebration or an event to remind ourselves as health practitioners, but also to remind everyone that menopause is here with us and it's a reality of life, and therefore there is that population in society that we tend to forget. And these are the women that have crossed this mandatory age of menopause. Menopause is defined as the cessation of menstruation. 12 months after the last menses have been seen, we define that as menopause. Now, the average age for menopause is 45 to 55 years, but the majority of women will get their menopause at 51 years. As I already told you, yesterday we celebrated the World Menopause Day, and this day started getting celebrated by the International Menopause Society since 2009. And the theme for this year has been cognition and mood. That is because we have come to a realization that these women who are in menopause experience a lot of changes, a lot of symptoms and signs of menopause. So every year in the themes, we pick one or two of the symptoms. Cognition and mood, as the words imply, are that these women experience a lot of changes in their psychology, in their being, which affect their cognitive capacities, and that has to be recognized, but also mood. If someone who was previously having always in high spirits, very strong, outgoing, the changes in mood setting and affect these women. But apart from the cognition and mood, we have other factors that affect these women. And we as health workers, we are duty bound to treat these women who come in with hot flashes, women who come in with paresthesia, burning sensations in the limbs, joint pains, back pain, chronic back pain, pains in the knee joints, the shoulder joints. We must address these concerns. Some of the women will come in because they have had a reduction in sexual libido. And as a matter of fact, we have seen with menopause, the libido is going to reduce, and you find that the husbands possibly still have an interest in sexual intercourse. So how do you help these women? Vaginal dryness is a very, very common symptom of menopause. And how are we going to help these women? So, as already talked about, it's our responsibility, one as health workers, to create awareness about what people should expect during menopause, but also address their personal challenges. Because of the symptoms of menopause, they all may not happen on one person. They happen at varying degrees in different people. You're going to find women who are in menopause and they have fertility desires. They want to get children. Someone is 45 years, someone is 50 years. How are you going to help them? So we now know that with a number of treatments, we can actually help these women to have their families get complete as per their wish. But how are we going to support these women? We must come in as health workers and support these women. Alert them, teach them, let them know that there are solutions. For some, they can even do what we call fertility preservation. These women can come in time, in their 20s, in their 30s, according to the progression they are envisaging. We do fertility preservation. We gather eggs, freeze them when they are ready, we fertilize the eggs and then they carry their pregnancies, they give birth. But also those who come and maybe they didn't do fertility preservation, there are a lot of solutions for them to become mothers even at a later stage as per their family wishes. Now, the issue of menopause, we can grade it into four. Menopause can happen in 4 ways. We have the natural menopause that we have talked about as cessation of menses for at least 12 months for us to make that diagnosis of menopause. That's natural. It happens to everyone, 45, 55 years, as already said. But we have people who, for medical reasons, will have to undergo iatrogenic menopause, or menopause that will happen because people have undergone treatment. For example, if a young woman comes in and they have any of the cancers in the reproductive system, maybe cancer of the endometrium, cancer of the ovaries, or even cancer of the cervix, which is very common here. If the doctor decides that the best is to remove the uterus and possibly remove the ovaries as well, then automatically we have sent that person into menopause, whether they are 20 years, whether they are 40 years, whether they are 30 years. And these women, at whatever stage, are also going to experience the symptoms and signs of menopause that I've talked about. They'll get the hot flashes, they'll get the brain kind of getting fatigued all the time, they'll get the paresthesia, the burning sensations, the reduction in libido, they'll get those psychomotor defects, the cognition, the mood swings, all those will happen at whatever age. We have those women who will undergo treatment for cancer chemotherapy, using chemotherapy or even radiotherapy, anything that is going to kill the cells, especially the fast dividing cells in the ovaries. Those are also going to undergo menopause or an iatrogenic menopause, and they will also experience the same symptoms as those that have undergone the natural menopause. Now, in practice, especially around fertility practice, where I spend most of my time now, we are getting a number of young girls in their 20s, 23, 24 with early menopause. Early menopause is real, it can happen, and still that diagnosis is made if someone has spent at least 12 months without seeing their periods. But also we have other diagnostic capabilities, performance of ultrasound scan, transvaginal ultrasound scan, to look at presence or absence of follicles in the ovaries and their characterization, but also hormones like anti-Mullerian hormone, hormones like follicle stimulating hormone. All those can give us an idea about who is now in menopause or who is not, irrespective of their circumstances. So talking back about early menopause that we see is happening, we have a number of risk factors, but we don't know exactly what is causing it. We know some people who have autoimmune diseases can get early menopause, but also there are people with abnormalities, chromosomal abnormalities, women who have Lesser Turner's syndrome. All those can get early menopause. Now, for society, for all of us in the community, our role is to identify these people with menopause and support them. Show them the love. If they have depression, over nothing, sometimes we ask what has happened, what is wrong, and they can't tell why the problem is. It's our responsibility to support them in our communities, recognize that these people are in menopause, therefore this might be going on in their lives. Sometimes the support you can give them is as simple as telling them there is a hospital here, there is a specialist here, there is a gynecologist here who can address your menopausal challenges. There are studies that have come up with toolkits that try to equip us clinicians and try to identify which of the women are getting challenges with menopause. Because as I've seen, a lot happens with menopause. Some people are going to gain weight, significant weight gain of between 0.3 to 0.8 kilograms per year during their menopausal periods and even above. So how are you going to support those women? If women are finding challenges with sexual intercourse, how are you going to help them? So in the hospitals, we now have a lot of supportive medicines that help these women. Hormonal replacement therapies are available to get people live their life fully. Some of these hormonal replacement therapies may be combined, for example, with estrogen and progesterone. Others are purely estrogen, HRT. So the way to go is, let's support these people, get them care. Sometimes supportive care and sometimes psychosocial care. And we also see that hypnotherapy is being performed with very, very good results. Thank you. I remain Dr. Hilary Ayisigwe, obstetrician and gynecologist. How many minutes?
You're watching AYIT TV, empowering you.